There we go. It appears to say we are live, so I'm going to assume we are live. And just checking the other computer, it says stand by, so I'm assuming that it's going to be functional. And I'll just turn that part off because we don't need that. And there we go. Thank goodness we can edit these videos after we go live and get rid of the front end. So, hello to our audience, those who are here today and those that will be watching the replay. I'm Dave Williams and really glad you've come to our second in our live broadcast. And hopefully you can see in the film strip, we have our guest and co-host, Sheila Shuster. So many of you had asked that she return because of her wonderful performance last month. So I asked her and she gratefully agreed to come on board. So in a minute, let me just have her wave her hand because I think yes, I can see her and hopefully the audience can see her. So there we go. Today, we're really carrying on a conversation with Dave and Sheila about coping with cancer. It's an area that's very dear to my heart, as you know, as a surviving cancer patient who is one of the lucky ones who have a positive outlook about the survival process. And there are so many issues we raised at last broadcast about the emotional issues that the cancer patient and the cancer survivor has to deal with. And we alluded that there were other things that have to be considered when the cancer patient moves into what's called survivorship. And today we're going to carry on that conversation talking about the emotional aspects that patients have to readjust to as they are given the go-ahead that they have finished their treatment program and are expected to get on with their life. And it's a very strange journey that the cancer patient is asked to begin. In fact, as I've talked to other survivors, it's as difficult to readjust from patient to person, as we've called it, as it was moving from person into a cancer patient. I thought there were issues that I understood cancer was all about, adjusted to the treatment program the best that I could, and then was told, go forth, young man. Cancer is not evident any longer. Your treatment program is over. You can get back into your life. Well, it turns out you don't go back into your life. You move forward into a new life. And that's why I wanted Sheila in particular to be here, because as a person who works with people in grief and in loss and in transition, she really does understand that once you've gone through a traumatic life event, and cancer certainly being one of them, there's a big adjustment process that you have to go through as you try to decide what your new normal is going to be like. And you know that's not a trite phrase. You know that's the philosophy that I'm bringing out to cancer patient survivors and caregivers, that moving into finding your new normal is something that you are asked to do. In fact, it's mandated that you must do because you can't go back. So let me just stop there and let Sheila welcome you, and let me publicly thank her for coming again today. Her analogies and comments last week were well appreciated, and let's see if I can turn on her camera so you can see her. And there you hopefully are on the display screen, Sheila. Say hello to our audience today.
Hello, everybody. I am so glad to be back because Dave and I have been talking for a long time about his journey and his experiences. And we've had the opportunity to talk about what I've seen from the outside, not being a cancer patient, but working with patients, working with their families, and just my perspective of what's really going on. And I was really excited to talk about this area of survivorship because, and Dave, you'll remember the last time we spoke a week or two ago, we were kind of chatting about what this felt like for you, and it sparked some memories for me. And what I've decided is there's a real progression that I've seen. It's fascinating what happens to a cancer patient when you go from your everyday life and all of a sudden you have a diagnosis. You are starting to give up a little bit of your intuition, and it happens slowly over time. But this is what I've seen, is that a lot of people don't realize they have an issue. They blow it off. They don't think it's any big deal, but then they finally go to the doctor and they find out they've got cancer. And it may be very shocking to them. A lot of people don't have a real connection with their body. They don't notice subtle differences, or we're busy, you know, we're just living our lives and we think, oh, this will pass, whatever's going on, the symptom. And when they finally realize that something has come their way and they didn't notice it, it's kind of scary. So that, on top of the diagnosis and all of the future things they're going to have to do with the treatments, really makes them question their intuition and question how they feel about their bodies and what's going on. And on top of that, the doctors and the healthcare workers are saying, we're going to take you through this path, and here's A and B and C, and we know what's best. So you really slowly start to lose this part of yourself, even what little you may have had to begin with, and you start giving that up to someone else. So during the process, you might have even heard this, I know Dave has, that you go into the doctor's office and you say, I feel great. And they say, well, your tests indicate otherwise. You don't feel great, you feel lousy, because this is what we see in the tests. And on the other side, you might go in and say, gosh, I feel terrible today. And you might hear a response like, well, that doesn't make sense. See, look, everything looks fine. So you must feel good. So you really start to question your own feelings and your own body. And I mean, goodness, who knows more than you about what's going on inside you? But they're taking experiential data based on, you know, lots of experience they've had about what has happened to other people, but that's not you. But we start really giving up our basic intuition, our gut sense that's telling us what we should be doing and how we feel. And then finally, Dave, I know this has happened to you, but you'll hear things like, you'll get a sense like, you know what, I think I want to stop this treatment, or I want to switch that, or in Dave's case, I think I want to have this PICC line removed. And you get all kinds of reactions like, why would you ever want to stray from the protocol? Don't you see what research has said? Don't you see we can't do that? And so you have all of these strong feelings coming in from your body and your mind, and then the healthcare system is saying, no, don't trust that, trust the numbers. So when you go from that for a series of months or even years of treatment, and then you're being thrown back out as a survivor, what do you have? You've lost all sense of what you can do to help yourself because you don't trust your own senses. You keep wondering, well, where's the doctor? I need my numbers. Where's the daily feedback or the weekly feedback? And that's where I think is that one of the first steps as a survivor that becomes really tough for you to step back into, you know, even if you let go of all of the issues around family and relationships and jobs, and your body is different and you're thinking differently, you have no sense of how to take care of yourself because you've given that away for so long.
Boy, are you ever right. I really have to add to that, this journey as the person entering the cancer treatment, where you start off having to learn how to give up control, how to become dependent on the medical experts, and then you become comfortable in the medical structure that's there. In order to survive, you start to understand the routines that you have to go through. Some of us have had long-term stays in hospital and see that there is a structure that we have to feel comfortable with in order to be treated effectively. And then when it comes to an end, and every day you're looking forward to the day that I can leave my treatment program, leave the hospital, And your friends are behind you. Your support network are likewise wishing you good health and wanting you to move forward. So there's this momentum to release yourself from the treatment program. And when that day comes, as in some clinics they do, they actually ring a bell and say, there you are, you finished the treatment, that journey has finished, you can move on. But you can't easily move on because you have become accustomed to the structure, you've become accustomed to the support mechanisms, you don't have the independence any longer, and you don't have control. In fact, you don't even have an identity of who you are. And that's a big surprise because there is no formalized support structure for the journey of survivorship. Now, there's a medical model, and a lot of the new cancer clinics are allowing, or not allowing, but creating a cancer survivorship plan that's even automated. But it's a medical model that talks about, well, what do you need from the oncology support team? What will you need in order to be scanned and make sure that there's not a reoccurrence of cancer? And so they are getting organized at saying that this is how you will carry on your treatment. But the psychosocial side of how do you emotionally adjust to this reemergence, or not reemergence, but emergence into a new world that is for you, is often very confusing, very frustrating, very fearful, and full of uncertainty. And I know today we're going to talk about how to deal with uncertainty, because that is one of the areas that Sheila spends a lot of time with. But the point that we're starting to talk about right now is the lack of understanding of the caregiver, that there's still a journey for the cancer patient to go through. There's a total lack of understanding from the cancer patient that there is something that they have to do. It's not a matter of, I've been released from the structure and I can get back into my world. And the family and support network around you has to readjust because they're not quite sure what is now to happen. They're very glad that cancer seems to be now under control, and maybe you're not in that life-death issue anymore. But not every cancer patient has a positive outlook. I've met so many survivors who were just beaten down by the cancer and are highly negative, highly suspicious, have not dealt with the emotions that came out of the treatment program. And for any cancer patient that had, let's call it a serious multiple month treatment program, they were forced to ask themselves, why is this happening to me? If I survive, and I want to survive because everyone's telling me today cancer can be beaten, as they say, and survivors can move forward. Well, if I survive, what will my life be like? Am I actually getting a second chance to live a different life? What would it be like? And these questions of who am I, what's my new identity, what's my new life, is very similar to being a teenager thinking about, when I leave home, I'm going to have a job, and I'm going to have a house, and I'm going to have a car, and I'm going to be married and have some children. Here's my picture of what that's all about. Well, surprise, the same perspective happens to the cancer patient. Some of them can't go back to the same home that they lived in. They need a physically different environment for them to move into. Their friends, some have stayed with them, some have left. The support network that came from their family are really surprised at what the changes have gone on with this individual. And they don't know what to do. And frankly, a lot of them are drained because of the pressure of coping with cancer and the cancer patient, and the pressure of learning to live with a person who may not make it. And so they want to put cancer behind and move forward, get on with their life, and they expect the patient to get on with that. And as Sheila had said last week, the perspectives are so different. the medical professional has a different understanding of what survivorship means than the friends and family and the patient. And we all are now with our mops, as Sheila said last time, trying to sweep the floors and get things cleaned up so that we can move forward. This is an area that's just becoming known, that there is another extended journey. People knew that, yeah, cancer treatment's going to carry on and you have to be checked frequently and there may be a fear of reoccurrence, but the issues of how do I adjust to my new normal, how do I even find a new normal, how do I surround myself with the support that I need for this new normal are brand new concepts. Have you faced that, Sheila? Is that something you've sensed?
Oh, absolutely, for sure. In almost every single case. And I think there are a couple of things that you brought up that are pertinent. They're all pertinent, but some that really struck with me is, and I know we've talked about this before, in the beginning of your treatments, you were given lots of alternative things to look into to help calm you. You were saying the mind-body skills that we've learned, whether it be yoga or meditation or some other tools to help you through the process. And the problem with that in the very beginning is that most patients are in such a heightened state of fear that it's not really realistic when you're very stressed and full of fear to bring something new and a new concept in. You have to be able to be open to that, and you can't do it when you're fearful. It's just the old fight or flight, that when you're fearful and you're scared of your future, your mind shuts down. So it's not allowing these new things to come in, and you might resist that. You might think it's hokey or it's, and I don't have time to do that. I don't understand why you're making me do this right now. But during the survivorship stage, this is really a great time for you to start looking into things like that. So both for the patient and the family members, this is a great time to investigate some of those mind-body skills where you are learning how to relax, where you are learning how to use your body in a new way, whether it's physically or whether you go off and find some fun things to do with dance or movement. It is reducing the stress. It is encouraging creativity, enthusiasm for life again. And when you were mentioning the caregivers, that was a great point, because they are fried. They are so tired and they're frustrated with all of the things that they've tried and that patients may or may not have been receptive to. People are, you're grumpy, you're tired, and so the caregiver never knows what they're going to run into with the patient. And when they're told that they're in remission or they're done with their treatments for a while, they tend to kind of ease off. They're taking their cues from the medical community and say, well, they're healing, so I don't need to be quite as invested. I need to take care of myself. And it's during this time that's really important for family members and the support system that is there to say, okay, we can lower our level of support a little bit, but we're going to shift it a little bit. What we really need to know is that that patient is starting from scratch. You're dealing with almost a new person. And as you know, Dave, your personality seems to have changed. You think about different things. You look at things differently. Your emotions are different, as well as your body. I mean, your body is completely changed. So you're starting with a brand new person. And it's important that the caregiver and family members understand that you don't just go back to the same thing. It is like introducing yourself to a new person. So you have to allow some space for that to happen. You have to be patient, and you do an awful lot of listening because you're reintroducing yourself to this person in your life. And then the last thing I think that caregivers can do is just help the patient learn to trust their own instincts. Encourage them. Well, if you're feeling this, you must feel that because you know best. You know best. And to start allowing that patient to trust themselves again, because they are eventually going to have to be completely out of the system. I don't know how often it is you're checking in, maybe once a week, then it goes to once a month, and it's all of a sudden they say, well, we'll see you in 3 months, and you think, what am I going to do between now and then? So for the caregiver and the family members to support them in a very encouraging way, saying, you know what, you're doing what you do best. If you're tired, you need to rest. If you feel like going out for a walk, go out for a walk. See how it goes. Really encourage them. So I don't know if you have any feelings about that, Dave.
Yeah, I mean, it's an awareness that I think both of us are trying to give to our audience today, that there are many new kinds of issues that are not thought of by the support network. Because the concentration has been on dealing with the treatment side. And now it's just assumed that, well, you've recovered, you've got a clean bill of health. And sure, you've got, as a patient, to go through a number of regular evaluations to see if cancer will reoccur. And yet the support network disappears. The external members disappear, and the family members suddenly have to go through a major transition. I mean, if you think of it, the pressure between a husband and wife has been stretched to the breaking point during the treatment program. And if there was any flaw in the marriage, it's been aggravated 100-fold. And now you recognize that, but you cut slack for each person. And now you're back together, and you've got to come together as a unit. Well, and if you have children, the children have been in a state of fear because, is my dad or is my mom going to live? And what's our life going to be like without them? And there's been a lot of discussion in the home front about what does it mean with mom and dad in the hospital or dealing with cancer. And now the person is returning and told you can get on with life, but they're not told everything is fine. 10 years ago, it was 40% of the cancer cancer survivors lived. Then it was 55% of after treatment, you have a chance of surviving. And sure, today it's 60, 62, 63%, depending on the kind of cancer that you have. But the cancer patient is still living with the sword of Damocles, because every 90 days, or certainly every 6 months, they're back into scans. And we call them scan anxiety, because we don't know what's going to happen. We're very fearful that that scan is going to point out a reoccurrence and that our life is going to turn to the negative. And so our families, our friends, are going to be brought back in every 90 days or 6 months, while you're starting as the patient, or now the survivor, to understand, am I going to live? And so the patient, just like at the beginning, learned to leave their world and come into the world of cancer and give up their independence and become a dependent and become comfortable in the support system. Now, when they're coming out, they want to come out and reassess who they are and what they're going to do. But certainly in my case, every 90 days, I'm right back into it. Oh, we're back into the hospital. We're back into the issues surrounding cancer. I'm back into being fearful. Am I going to have to deal with cancer again? And frankly, the media are constantly talking about cancer, and I can't get away from it every day. Even the television programs that I'm watching, they now have a plot line of dealing with a cancer issue. And so I'm constantly being bombarded with, cancer is prevalent. You may still have cancer. You still have other issues. How am I going to get on with life? And I have learned to be patient and deal with the unexpected, but the uncertainty for most survivors is really a difficult thing to adjust with, because you recognize that the only certainty is the fact that nothing is certain. And you knew that during the treatment program, and yet our expectations are, well, I can reestablish my relationship with my children, with my wife, with my people at work. In fact, I can even get back to my job and carry things on. I can build a life again that I've left, and yet at the same point, I sit there with the sword of Damocles, as I said, over top, waiting for the next shoe to drop and the more pressure and problems on my life. And yet your support network has all disappeared, because they've just assumed that they were there to help you because you were sick. There was compassion. They were concerned. They knew you were, as a patient, having a terrible time in your life, and they want to be there to support you, to provide the love that you were looking for. And now they're just assuming, well, get on with it. You get on with your life. And some even get back to your old life. And as you just said, hey, if your personality has changed, I'm a far more patient person, a more gentle person, a more in the moment kind of person, living in the present, less aggressive, less controlling. I see myself differently, and yet that new suit of clothes that I'm wearing hasn't yet been seen by the people around me. And I've got to educate them, but they've all disappeared because they say, well, you're not sick, you're not in the hospital, I don't have to help you with your dishes, I don't have to help you with your food, I don't have to pick you up and take you to the doctor's appointment. So everything must be okay and you're getting back into normal. And that's not the case.
It's true. And I see Alan has written a question over here that's great. And I do think that there's a need for almost survivorship training. And it's with all three components. The healthcare system needs to understand that that's a necessary component, as well as the patient and the family members and support, because there are things to be learned about this stage. And it does have to do with learning to expect what you don't expect. As you said, you're learning to get comfortable with being uncomfortable, understanding that you're never going to be exactly the same. And it's going to be this evolving process. And to be able to work through that, I think you really need to get to a place where you do tap into some of those mind-body skills. And of course, that's where my training is, but that's what I'm passionate about. And it's about really understanding how your thoughts affect your body and how your body affects your thoughts. And as you said, Dave, learning to accept each day as it comes, to learn to live in the present moment, really embracing what's here for you now as this new person in this new life, possibly with new relationships. Certainly they've changed. So there's a tremendous opportunity, and I'm not sure how it fits into the healthcare realm as far as insurance and how that fits into standard protocols, but that doesn't mean that we can't, on a social basis, find ways to develop communities around this. And of course, online is the easiest way to do that, where we can get groups of people together and talk on a routine basis, bring in components, bring in the healthcare worker, bring in a caregiver, and bring in the patient, and have a dialogue to talk about what's the experience, what are you feeling like, and what can we do to start moving through this next stage.
And some of the support groups are just recognizing that. As I mentioned to the audience last month, I literally had set up a lifeline with mylifeline.org because they were there to help me communicate my needs to my support community during the treatment program. And in talking to them just recently, they're now recognizing that, hey, perhaps there's a need to provide support for survivors, that there are different kinds of issues, that we've got to tell the patient it's okay to talk about perhaps your lack of self-confidence or your still residual set of frustrations or anger, the fear that you have, the needs that you are still looking for from your support group, to if nothing else, just to be acknowledged that other people do know that your treatment program may have been complete, but you still need help. You still need support. You still need the love. You still need to be hugged. You still need a lot of the support from the healthcare professionals and the support network and your primary caregivers, and certainly your family, as everyone starts to readjust to this new world, and perhaps some new skills. I mean, Sheila, one of the things you and I have talked about is the whole idea of where does a sense of gratitude come in terms of the healing process? Where does a mindfulness join in the healing process? It'd be nice that everyone could understand the value of meditation, but there are other things that help keep that person living in the moment, because as you and I have talked so often, we tend to think about the past a lot, and we think about all the worries of the future, and we don't
Right.
give much to the moment that we're in. And yet the patient has learned, surprisingly enough, that all you can deal with is what's happening today. Tomorrow,
Right.
you have not a clue of what's going to happen. So now
Right.
when I'm leaving that cocoon, I have learned I don't know what's going to happen tomorrow. So I'm just going to be dealing with today. And hey, support network, I am struggling still because I don't know who I am. I don't know where I'm going. I don't know what I need, but I do know that I'm fearful, I'm anxious, I'm stressed, and I'm living in a world of uncertainty. And I really want to find a new normal of comfort. Please help me. And maybe some of these other techniques, are the things that this survivorship program that Alan was mentioning, might be a good thing to add.
You bet. And I wouldn't it be great if there was an umbrella that goes over the whole process from the day that they're diagnosed all the way through until end of life, because as you mentioned, survivorship stays with you forever. And so you have this lovely umbrella that sees the big picture, that sees that all these things are important all the way through. And the meditation and things that are a little bit more in the mainstream, they definitely have a place in this for sure, and yoga and some wonderful alternatives. But if people aren't ready for that, especially in the beginning, there are really simple ways, simple things you can integrate into your day every day to bring some mindfulness and some living in the present moment that are just very light and easy and not as overwhelming as someone going into cancer and saying, now I have to learn how to meditate. And these are tiny, small steps that everyone could do every day, no matter what your stress level is, no matter what that's about. And that's why I think communities like this, we can get together and just start talking about little ideas. Hey, I tried this and this works for me. And it's very, very simple ways to integrate this into your life that I think over the long run, from the day of diagnosis all the way through, you'll be able to step into and tap into these almost life-changing skills that will help you no matter what is going on in your life.
And I think the message that we're trying to bring to our audience is, if you know someone with cancer, still be there for them and help direct them to additional types of resources. And I don't know how many people have watched that Ken Burns documentary on cancer, The Emperor of All Maladies. It was on PBS a couple of weeks ago. 3 evenings, 6 hours of information about cancer and cancer research. And one of the important takeaways for today's discussion is there are, in fact, 12 million survivors, people who have finished their treatment and getting back to a new normal. However, in the next 8 years, that number is going to be 23 million people. Because of the great research that's being done, the great treatment that's being done, we're increasing the survivability of cancer patients. And yet we haven't got the infrastructure built yet to do anything with these 23 million people who are like myself, and I have no difficulty in telling people it's still a struggle. It took me months to just get used to coming back out of the hospital world. And it's taken me a few months now thinking of myself as a productive person who can work. If you could just imagine what it would be like of a male or female who wants to come back into the workforce, how are they going to get back into their job that may have changed, and their boss has changed, and their coworkers have changed, and everyone wants to talk about what happened, but they don't want to get into the details, and the patient is still struggling and can't work full-time hours, and there's a whole reentry process that has to happen just on something as simple as the workforce reentry, let alone what has to happen with the cancer patient getting back into a good family relationship with their significant other and their children. And so caregivers that are out there understand that there's still a journey for the patient. Patients who are watching this, be aware that there is yet more ahead of you, and don't be disillusioned when you suddenly recognize that this journey may not have a quick end. This may go on for many years as you continually have your scans and evaluate with the medical help that you have, am I safe? You know, is cancer under control and not reoccurring? So I don't have to have the fear. I can get along by building a new kind of life for myself, and learn as a patient to reach out to people and the support groups like the My Lifelines that are there to try and help you, and maybe even reach out to cancer coaches who are now evolving themselves to say, yes, we understand it's not just dealing with the trauma of treatment. It really is about how do you live in the moment? How do you understand that every day of life that you have is a gift? And what are you going to do with that gift? And if you're not in a positive frame of mind, then how do you move from the negative headspace into something that will allow you to be productive and have meaningful relationships with everyone? So, you know, those are sort of hopefully the messages that we want the audience to take in this coffee conversation. Any concluding remarks from you, Sheila?
Yeah, I think you just touched on so many that there are just so many aspects of this. And I think what we can do is what we can do. We continue things like this. Excuse me. We encourage other people to start communities. Certainly Google Plus is a wonderful place to do that. And it's just about talking and being understanding that there are other patients out there that want to talk to you about it. There are caregivers who are wondering what to do, family members, support groups who are looking to help, and they're out there. So it's a matter of starting and talking about it and being willing to be vulnerable and bring up things that may have been uncomfortable or still are uncomfortable, and understanding that so many people are in the same boat, and we can do it together.
For sure, we are not alone. We do not have to be hermits. We can get out there and move forward, but we have to be taught as patients how to do it. The caregivers have to be taught that there's a system to be there. And I think that's probably what we're going to talk about next month, Sheila, as we get our coffee pot out, and hopefully other guests will join us and talk about coping with cancer. And you know, I think this topic of how do you survive in a healthy, worthwhile way so that your life can be in the kind of life that you envision, that you take advantage of this second chance that you have to move forward. And perhaps that's what we'll talk about next month, if you're available, Sheila. I hope that your schedule will permit. I know you're super busy. But let me thank you for being here today and having coffee with me. And hopefully the people who watch this, either watch this today or will watch the replay, will sense that there's something of value and will leave us a comment. Remember, on the website, Find Your New Normal is a place to leave comments. There's an Ask Dave area where you can be very pointed and tell us, you know, what we're doing and what we're talking about, and is it valuable, and give us suggestions. And get on our mailing list so we can tell you what date in May we'll do the next thing. So let's thank everyone. Well, both Sheila and I will say wave to you, and thank you for coming.
Cheers.
And we'll see you next month.